The underlying mechanisms for drowning can be even other than the main submersion phenomena. It can even contribute towards the dry drowning phenomena, as we were already discussing. It's basically a vasovagal inhibition reflex that can take place in a lot of situations, in which basically the cardiac arrest basically takes place due to this reflex action rather than the hyperinflation of the lungs or any cardiac stress that has occurred due to drowning. So even we have to consider all of these pathologies whenever we are considering deaths from drowning. Other than that, now whenever we are considering these mechanisms for drowning, we have to basically calculate what kind of mechanisms, what kind of underlying pathologies were there when the drowning or the submersion took place. The incident, the environmental factors are again very important in this regard, and we have to focus on what kind of drowning has taken place, whether it is a freshwater drowning or whether it is a saltwater drowning, and we have to even differentiate between the ante-mortem and the post-mortem type of drowning. These are basically the highlights for a forensic practitioner whenever he comes across any case of submersion deaths. Now, the autopsy signs of drowning are again very important. How are we going to document all of these signs whenever we come across these drowning phenomena? They are very important, and basically the documentation part is important in a sense because it is a recorded form of what you saw. So it's basically how you interpreted the case, and it's very important, and it has its legal points. So we have to keep in our mind that it has its own significance, and we have to be quite accurate whenever we calculate these deaths and we calculate the underlying pathologies for these submersion deaths. So in this section, basically, the death from drowning and the mechanisms will be discussed in detail. And here, basically, this flow chart basically emphasizes on the underlying process or the underlying mechanism that takes place whenever drowning takes place. The involuntary gasps or the aspiration of water into the hypopharynx is a phenomena that takes place whenever this drowning comes into play. Then we have the laryngospasm or the parasympathetically medicated. Basically, this is a whole process, and after this, the reflex action takes place, and the vasovagal inhibition is another thing that basically comes into play whenever this laryngospasm takes place. Now, after that, we have basically divided it into the dry drowning syndrome and the wet drowning syndrome. Now, the dry drowning is basically the percentage is very low, that is almost 10 to 15%. And on the other hand, if we take a look at the wet drowning syndrome, it has more incidents, like about 85% incidence is recorded in such cases. Now, the cerebral hypoxia is another thing. That is basically, hypoxia is basically accustomed as low levels of oxygen that are basically carried towards the brain. So it is regarded as the cerebral hypoxia, and it can basically be also result in the acidosis, that is the metabolic acidosis, and then it is going to result in the cardiac arrest. So these are basically the functions, these are basically the factors that are going to contribute towards the cardiac arrest and the death may ensue in such cases. Now, the brain injury and the death is very important, and how basically this takes place. This is basically, obviously, the underlying cause is the cerebral hypoxia in such deaths, and that is basically the highlight for these deaths from the drowning. Now, shallow water blackout, it's basically a phenomena in which, first of all, there is hyperventilation, and that is basically marked with overbreathing either consciously or as a result of the overexertion. And it is artificially maintained at low carbon dioxide levels. And then again, at the second level, we have the oxygen drops. Now, what happens here is basically, as the breath is held up by the person, the oxygen is metabolized and the carbon dioxide level increases in such a person. As the breath hold continues, the body becomes starved of oxygen, and there is a state of oxygen depletion in such a person. Now, at third level, we have the unconsciousness that basically sets in after this blackout, and that is basically why it is regarded as a blackout, because the person becomes unconscious at this level. Under normal circumstances, increased carbon dioxide would trigger a breath, but because carbon dioxide levels were so low on submersion, there is not enough to initiate a breath, and the swimmer loses consciousness in such cases. And then at the fourth point, once the swimmer loses consciousness, the body reacts and forces a breath. that basically causes the lungs to fill up with water, and that is basically going to result in hyperinflation of the lungs. Without an immediate rescue, a drowning death is basically certain at this level. So at this fourth stage, it is the most fatal stage, and the death is basically certain at this level. So, autopsy signs of drowning. What are basically the autopsy signs that we are looking for whenever we have deaths of such kind? Basically, it depends upon the delay in recovering the body from the water and starting the post-mortem examination. So, what are the signs basically that we are looking for whenever we are going to suspect any a post-mortem drowning? Now, in post-mortem drowning, basically what happens is they're basically going to be signs of asphyxiation. Cyanosis is another phenomena which can be seen in such person. Now, as I was talking about, cutis anserina is, or goose bump or goose flesh phenomena are again signs which can be observed, and if they are found, they can be written down in the autopsy report. And then we can have the maceration phenomena. Maceration is basically, it is defined as the leathery, white, hard appearance of the skin of the palms and the soles that takes place over here. And it's basically going to indicate the post-mortem type of drowning. Now, if we have any traumas that we find out in that person, for example, if the person had sustained some sort of injuries before the submersion phenomena took place, even we are going to document those traumas over here. And we're going to write down what kind of traumas he had. Even if he had encountered some traumas in the water or while he was drowning, that has to be encountered in detail while we're writing down the autopsy report. Because this is very important, and we are going to document basically what type of crustaceans, what type of mollusks, what type of predators were already present in such environment. That we are going to note down in such a person. Now, froth in the air passages is another sign that we are going to see in these submersion deaths. Froth is edema, fluid from the lungs, and it consists of a proteinaceous exudate and surfactant mixed with water of the drowning medium. But again, we have to consider this fact that this froth doesn't remain for long, and basically if the time since death is more, it is not even present over there, but we still can identify some sort of froth in the trachea and the air passages, and we can still sustain its benefits. Now, it is white, but maybe pink, or sometimes it is blood tinged, red tinged, and extends into the trachea, and the main bronchi and the smaller air passages are sometimes also involved in these fine froth from the alveoli. Now, the dry lung drowning, these froths are not present because the laryngeal spasm has already took place and the water doesn't enter the lungs in these cases. The overinflation of the lungs is seen in such cases. What happens over here is the generalized waterlogging phenomena, and the lungs are overinflated even on the X-ray or the radiological examinations. They may bulge upwards whenever the sternum is removed, and they're over bulging and they're hyperinflated. The texture is pale and crepitant. Emphysema aqueosum is a term which is used for such hyperinflated lungs. Now, overdistension is basically found in such lungs after the submersion phenomena, and the intrapulmonary hemorrhage is also found in these overinflated lungs. Then we have the Paltoff's spots, and which are seen even on the gross examination. They are basically the hemorrhages that are found on the lung surfaces. The comparison of the forensic pathology of the lungs. We have the size and weight. They are ballooned. If there is freshwater drowning, what are the features we are going to see? The size and weight, it is going to be ballooned but light. On the seawater drowning, they are going to be ballooned, and the weight is almost going to be about 2 kgs. Now, regarding the color, in freshwater drowning, it is pale pink. And in the seawater drowning, it is purplish or bluish in color. And the consistency is amphisematous in the freshwater drowning, and it is soft, jelly-like consistency in the seawater drowning. Then the shape after removal from the body. In the seawater drowning, it is basically doesn't retain its shape, it flattens out. And in the freshwater drowning, it is retained, but it doesn't collapse. Now, sectioning is also very important. The crepitus is heard in the freshwater drowning, and no crepitus or copious fluid and froth is heard in the seawater drowning. Other organs that can be also included in drowning, and we have to investigate these organs as well, can be the heart and the great veins. They are sometimes found dilated and engorged with fluid blood whenever we investigate these heart and the great veins in cases of submersion phenomena. Hemodilution is another factor which is seen in the freshwater drowning, and the stomach may contain watery fluid, or even foreign material may be found in the stomach. The foreign materials in the trachea are again noted down whenever we suspect the submersion phenomena. Hemorrhage into the middle ears and into the temporal bones are also sometimes found whenever this submersion phenomena comes into play. In this section, basically, we dealt with the underlying mechanisms that basically takes place whenever the submersion phenomena takes place, and what are the other organs, how are we going to basically write down the autopsy report and the other organs that we are going to investigate in such submersion cases that are also discussed in this section. That was the end to this section. Thank you for watching sqadia.com.